So, Mike, you've been looking at the vaccine rollout across the world, and you're looking at how many people in populations have been vaccinated, and you're doing it per doses per 100 people. Explain that to us.
Yeah, that's right, Sally. So, of course, different countries have different sizes in terms of their population. So if you just look at the raw numbers, it can be a little bit confusing. It's better to look at doses per 100 people, because then you get a real sense of how a distribution campaign is actually working. So you get rid of some of those discrepancies between a massive population and a small population. Let's focus very quickly on some of the numbers. We're going to focus first of all on Israel, Sally. Israel has been a little bit controversial in the sense that a lot of these vaccines haven't made their way to some of the Palestinians in the West Bank and Gaza, but still 38 doses per 100 people. So that's some of the highest numbers in the world. Another country which is doing really well, United Arab Emirates, 23 doses per 100 people. What you'll see with both of these countries, small populations and small land areas, so they're able to get their vaccines to people very, very quickly. The UK is interesting. It's the leader in terms of Western Europe, Sally. At the moment, 8 doses per 100 people. The key thing with the UK is that it has a centralized health system, the NHS, and it seems to be able to coordinate the distribution really, really well. The opposite is true of the USA, 5 doses per 100 people, and it's come under serious criticism because it just didn't have a national COVID-19 vaccination plan. It's all been done by the states in various different systems, and the experts say that has not worked. Italy, remember, that was the epicenter of the crisis in Europe. At the moment, Sally, 2 doses per 100 people. So those are the numbers. Let's focus on the key lessons as we bring that up, Sally. The experts saying, again, that small populations really offer an advantage, if you want to put it that way. Short distances, so a relatively small land mass, making it much easier to get to people very, very quickly. And then centralization. As I said, the UK is a good example where your public health care system is centralized and can really focus on one single plan to get the vaccine to the population. Those, it seems, Sally, are the key points that we'll have to take into our campaign as we roll it out over the next few weeks.
Yeah, so what we know about ours is there's 1.5 million doses due to come to South Africa, I think, from India before the end of the month. And those are going into the arms of our healthcare workers, and then what's left over will go to vulnerable people. But of course we need many more doses than that.
Yep.
And we don't have all the details. We know there's lots of discussions going on. Talk to us about the timeline, Michael.
Yeah, let's focus on that very quickly. Cyril Ramaphosa, speaking as the ANC president, actually mentioned some of the numbers earlier in the week, Sally, saying that the plan is to get the vaccine to 40 million people, hoping that that will be done within the next year or so. It wants to reach a point, government wants to reach a point where it's averaging about 316,000 doses per day. The president also saying that this project would be bigger than the 2010 World Cup, bigger than organizing a national election. So that just gives you a scale and a sense of how big this project will actually be. I just wanted to focus on Israel again very quickly, Sally. In terms of the timeline there, what you're looking at here is the daily doses administered. And what you see there on that pulsing dot, Sally, is where it actually reached the point where it was delivering 200,000 doses per day. You'll see that it took quite some time. In fact, it was only a few days ago that it reached that milestone of 200,000 daily doses. And I think the lesson here, Sally, is that when the vaccine arrives in South Africa, it doesn't mean that suddenly we'll have hundreds of thousands of people getting it in a single day. It will take some weeks, possibly, for us to build up to reach that point where we are distributing this vaccine on a massive, massive scale. So perhaps that's a lesson that we need to keep in mind as we get ready for the rollout.
And we're not the first, we won't be the first country in Africa to receive the vaccine, will we?
No, we won't. Egypt apparently started its vaccination drive on Tuesday last week, focusing on hotspot areas. focusing on healthcare workers and people in vulnerable positions or jobs. So Egypt has already led the charge. We'll be keeping an eye on those numbers and see how that goes. And South Africa hopefully can learn a few lessons from their Egyptian counterparts as well.
Absolutely. Thank you very much, Michael Murillo.